Right now, millions of seniors across the country are unknowingly breaking Amazon's rules, and most of them have no clue it's happening. Some of these violations can lead to your account being shut down permanently, with zero warning. Others are quietly draining money from your wallet every month, and Amazon isn't going out of its way to tell you about it. Here's the full picture: what got banned, what shifted, and most importantly, how you can end up paying a whole lot less for the exact same Amazon benefits starting today. And before we dive in, if this kind of information is useful to you, hit subscribe on Informer John right here on YouTube. You'll want to know about these things when they happen. Now, let's start with the change that's affecting the largest number of seniors right now. For years, Amazon Prime offered something called the Prime Invitee program. If you had a son or daughter across the state with a Prime membership, they could extend shipping benefits to you, even if you lived in a completely different home. Millions of older Americans relied on this arrangement to enjoy free 2-day shipping, Prime Video, and other perks without ever paying out of pocket themselves. That program no longer exists. Amazon shut it down and did so with very little fanfare. Today, the only sharing option Amazon offers is something called Amazon Household, and that requires both people to be at the same physical address, not nearby, the same home. If you and your family member are in separate households, even just a few miles apart, that benefit sharing arrangement is no longer valid. So if your free shipping suddenly stopped working, or you lost access to Prime Video without explanation, this is almost certainly why. You'll need your own membership going forward. But here's the thing: most seniors qualify to pay significantly less than the standard rate, and I'll get to that shortly. Now, there's a second issue Amazon has made very clear in its official policy, and knowing this one simple rule could protect you from losing a lot of money. Amazon does not place outbound calls to customers. That's not a recommendation or a best practice, it's Amazon's publicly stated policy. They will not ring you up about a problem with your account, a suspicious charge, a delivery issue, or anything else. It simply doesn't happen. So if your phone rings and someone identifies themselves as being from Amazon, let me be very direct. That person is not from Amazon. That call is a scam. Here's how the scheme typically unfolds in 2026. You get a call from someone who sounds professional and maybe a little urgent. They tell you your account has been compromised, that an unauthorized purchase was made, or that your account is about to be locked. They create pressure. Then they ask you to confirm your identity by sharing your password, your card number, or a verification code that just arrived on your phone. The moment you hand over any of that, your account and your financial information is in someone else's hands. During 2025, the Federal Trade Commission tallied up complaints about Amazon impersonation in the hundreds of thousands, making it one of the most frequently reported scam categories in the entire country. Older adults bear the brunt of these schemes because scammers operate on the assumption that seniors are more likely to comply with someone who sounds like an authority figure. The protection comes down to one simple truth: Amazon will not call you. If a caller claims to be from Amazon, end the call immediately. If you're worried about your account status, go directly to Amazon.com yourself. Log in and check your orders and account details from there. Never use a number that an incoming call tells you to dial back. Now, the third issue is one that most seniors have genuinely never heard about, and it's the one most likely to result in a permanent account closure without any notice. Amazon systems track your return activity. The exact threshold isn't published anywhere, but the widely understood range is somewhere around 10 to 15% of your total purchases. If your return rate climbs into that territory, Amazon's algorithm can label your behavior as return abuse and close your account. No warning email beforehand, no formal appeal process, just a message telling you that you're no longer able to use the platform. What's particularly frustrating about this is that the behavior that triggers the flag is completely understandable. Ordering a few different sizes of a shirt to find the right fit, then sending back the ones that don't work, that's sensible shopping. But Amazon's automated system doesn't weigh your intentions, it just reads the numbers. The practical advice here is to slow down before clicking buy. Use Amazon's virtual try-on tools when they're available. Read the size charts carefully. Go through reviews from people with a similar build. Ordering one item you're confident about is far less risky than ordering 5 and sending back 4, even if that approach feels completely logical from a shopper's perspective. Now let's talk about the good news, because there are real ways to pay less for the same Amazon benefits, and most qualifying seniors haven't taken advantage of any of them. The first is a program called Prime Access. Standard Prime membership costs $14.99 per month, or $139 annually. But if you receive certain qualifying government assistance benefits, you're entitled to a discounted rate of $6.99 per month, which works out to about 53% off the standard price. Nothing is reduced. Same delivery speeds, same streaming access, same everything, at roughly half the cost. The qualifying benefits include SNAP food assistance, Medicaid, and I want to pause here because this trips people up constantly. It's Medicaid, not Medicare. Those are two separate programs, as well as supplemental security income, the LIHEAP Energy Assistance Program, temporary assistance for needy families, WIC, the National School Lunch Program, and the Direct Express Federal Benefit Debit Card. That last one is especially worth noting. If your Social Security payment arrives on a Direct Express card, that card alone qualifies you for the discounted rate. Nothing else required. There's also an income-based path that doesn't depend on any specific program enrollment. If your household earns around $27,315 or less per year as a single person, which is where many seniors living primarily on Social Security fall, you may qualify through income verification alone. The process takes roughly 20 seconds through a secure third-party system, and no document uploads are needed. To get started, visit Amazon.com/Prime Access. Sign into your account, choose your qualifying program or the income-based option, and follow the steps. If you're currently paying the full $14.99 per month, making the switch saves you $96 every year for the exact same service. One misconception worth addressing. Your AARP membership doesn't unlock a lower price on Amazon Prime. There's no pricing arrangement between AARP and Amazon. If you're an AARP member paying full price and you also receive Medicaid, SNAP, or any of the other qualifying benefits, your path to savings runs through that benefit, not through AARP. The second savings opportunity is something called RX Pass, and it comes bundled with your Prime membership. The catch is that the overwhelming majority of eligible seniors have never switched it on. Through RX Pass, Prime members can access more than 50 widely prescribed generic drugs for a flat monthly charge of $5. One $5 fee covers unlimited refills of any qualifying medication on the list. The drugs included address conditions like elevated blood pressure, high cholesterol, type 2 diabetes, anxiety, depression, and a range of other chronic conditions very common among older adults. If you currently pick up any of those medications at a pharmacy and your total out-of-pocket cost runs higher than $5 a month, RX Pass is absolutely worth investigating. Enrollment costs nothing and takes about 5 minutes. Head to Amazon.com/RxPass, log in with your Prime account, and take a look at the medication list. A couple of details to know before you sign up. First, if your Prime Access qualification comes through Medicaid, you won't be able to enroll in RX Pass. Their system will prevent it automatically. You can still use Amazon Pharmacy and receive standard discounted pricing, but the $5 flat rate plan won't be an option for you. Second, if you have Medicare, including Medicare Part D, you are eligible for RX Pass. You just can't apply both benefits to the exact same medication simultaneously. In practice, most people handle this sensibly. Rely on Part D for brand name prescriptions where your plan provides strong coverage, and lean on RX Pass for the generics where $5 is cheaper than your copay. A lot of seniors use both programs side by side, and it works out well. One more thing. RX Pass is currently unavailable in Louisiana, Minnesota, and a handful of other states due to state-level pharmacy regulations. So check your eligibility when you go to enroll. Finally, here's something worth knowing before it affects your budget. Analysts at JP Morgan have projected that Amazon is likely to increase the standard Prime membership price from $139 per year up to $159, a $20 jump, sometime in late 2026 or early 2027. That would mark the first rate increase since February 2022, when the membership price moved up from $119. Amazon hasn't made an official announcement yet, but when these changes have come historically, The company provides 30 days notice. If you're currently paying month to month at $14.99, switching to an annual plan at $139 now locks in your current rate for the next 12 months, regardless of any announcement that comes during that period. And even without factoring in a future increase, the annual plan already saves money at today's rates. $139 for the year beats $179.88 spread across 12 monthly payments. The math simply works in your favor. So here's the full picture of what we've covered. Amazon ended the Prime Invitee program. If you were sharing Prime benefits with a family member in a different home, that access is gone and you'll need your own membership. Amazon never makes outbound calls to customers, ever. If someone phones you claiming to be from Amazon, it's a scam. Hang up immediately and don't call back. Check your account directly at Amazon.com if you have concerns. Returning a high percentage of your orders, somewhere in that 10 to 15% range, can trigger Amazon's return abuse detection and result in a permanent account ban with no warning. Be more deliberate before you order, rather than buying multiple options and returning most of them. If SNAP, Medicaid, SSI, LIHEAP, or a Direct Express card is part of your benefits picture, you qualify for Prime Access at $6.99 a month, roughly half the standard price, at Amazon.com/Prime Access. Most eligible seniors haven't yet activated RX Pass, which covers more than 50 generic medications for a flat $5 a month, included with your Prime membership. And if a price increase is on the way, locking in the annual plan at $139 now is the smart move. If this video helped you today, I'd really appreciate you subscribing to Informer John right here on YouTube. It's the best way to make sure you catch this kind of information when it matters most.